Shalom, shalom. Before going to this lesson, all praise and glory to Yahweh. Bashem Yahushai, Bashem Kodash. Double honors to the apostles and elders and GMS, they rule well. And to all you brothers in the four corners of the earth and sisters of the awful elect. This is a quick lesson on the RFID microchip. What is the microchip? I will call this one. Call this lesson, what is the microchip? Alright, so to call this lesson, and I'll start it off with the search bar. What is the mark of the beast? And I'll start it off with a small lesson, a small documentary. Small documentary, because the mark of the beast is the RFID microchip. That's the mark of the beast. The mark of the beast is not tattoo. It's not 666. That's the number of the beast. Alright, that's the number of the beast. Alright. Let's go to RFID microchip, because all these documentaries that I was at, they was actually documentary that I was at, they was actually telling you about trying to decipher the mark of the beast. Alright, but the Bible clearly tell you that it is the microchip implant.
So make a fist to squeeze the tag to the top of my skin. And when I approach the device, it opens the Facebook page I set it to.
Colin Cravino has a microchip implanted in both of his hands.
Some people just look really grossed out. I put my hand up and I let them poke at it and they freak out.
Developed in the 1950s and 60s, RFID chips, short for radio frequency identification, have been used by retailers to track packages and prevent theft. Farmers use the chips to keep tabs on their livestock. Pet owners use them to identify their cats and dogs. And lately, members of the so-called body hacker movement have been implanting RFID chips under their skin, programming them to perform various tasks. Colin Cravino, a smartphone repairman in Brooklyn, New York, uses his chips to open his front door. He found them on a website called Dangerous Things that sells implant kits and offers user tips.
I came across it when I was doing research on the Samsung deadbolt that I bought. And then the first thing that I noticed was that I could get an RFID tag that would work with the deadbolt.
Cravino plans to modify one of his motorcycles next.
And I haven't decided on where I want to put the authenticator, the antenna. Thinking probably down by the seat somewhere, because this comes off. So I would just tap my hand on it. Then the light would come on as if I put the key in. And then I would just hit the ignition, start the vehicle.
RFID retailers estimate that between 30 and 50,000 people worldwide have chip implants in their bodies. German tech consultant Andreas Sjöström used his chip as a boarding pass on a recent flight from Stockholm to Paris, and to get into an airport VIP lounge. Skeptics say the implants raise privacy issues and worry that strangers could tap into the information on a chip without the owner's knowledge. Others say potential uses for the technology, such as keeping track of a patient with dementia, could pose ethical concerns. But Cravino and others see a future where technology and the human form will merge.
I think when it becomes more prevalent and there's a lot more things and options that you can do with this, that people will, opt in for that kind of augmented human sort of attitude. That's why I have an Android device and not an iPhone, is because I want to be able to customize everything I have, so why should I not be able to customize myself?
Alright, new brain implant begins human trials. Let's look at that.
Elon Musk's
Musk's brain implant company Neuralink is the billionaire entrepreneur's venture into an experimental medical industry known as brain-computer interface, or BCI. And in the 6 years since Neuralink was founded, there has been massive progress generated in the field of BCI. Some of that coming from Neuralink themselves, with their work implanting devices into pigs and monkeys, including one now infamous monkey who can play Pong using nothing but his thoughts, thanks to the digital telepathy enabled by BCI technology. And now, the next generation of brain-computer interface is going to human trials for the first time in the United States. However, the first BCI procedure to be approved by the FDA is not going to be a Neuralink. It's a device called the Stentrode from a competing private company called Synchron. And knowing our usual audience, some of you might find that news upsetting. But I'm going to quickly turn that around and say that this is a great thing for literally everyone, Neuralink and Elon Musk included, because competition is the best thing to push an industry forward. Strong competition and a variety of products on the market will accelerate innovation and new discoveries. So, let's get into the current state of the BCI industry and how Neuralink fits into the broader picture. So, obviously when Neuralink was founded in 2016, there was a ton of fanfare and media attention around the company, and that was due entirely to the person behind the project, Elon Musk. The news lit up with stories about how Elon Musk was going to put implants in people's brains that would cure all diseases, make you smarter, let you control a computer with your brain, and even interface with an artificial intelligence to become a human-machine hybrid super being. It was all a bit extra, but that's just how things go with Elon.
Why Edom is known as the wicked, and why is them the so-called white man is because the so-called white man lineage go back to Esau Edom. The word Edom means red. It comes from the Hebrew word Adon. Alright, it means red, and the Esau means Ishashua in the Hebrew. When you go back to the reason he got the name because when he was born he had no pigment. Alright, he come out like how you see the so-called white people today, as white. He didn't have no pigment. So his father, at around that time, everybody used to born with pigment. So his father and his mother, which is Rebecca and Isaac, call him Esau Ishashua, which means wasted away is he. Because at that time everybody had pigment and he was just strange looking. Alright, and according to the scripture, according to the Bible, that's leprosy. And they know the laws, that is an unclean thing. So they tell he wasted away is he because he ain't feeling he wasn't healthy. So that's how the white people link to Esau today. That's the lineage. So from Esau you got the so-called white people. Alright, Esau is the progenitor of the so-called white race. Alright, he is the progenitor. The progenitor is the father of a nation, where the lineage of a nation go back to. So Elon Musk stem from Esau, and they are known as the wicked. That's why they're trying to turn you into a human cyborg. Alright, they want to put a brain chip in you to enslave you and put you under their control. You follow? I hope that is clear enough and it gives you clear understanding, perspective. Alright?
He doesn't have a filter. He just says all the wild, fantastical things that are in his brain, and the media reports it. So Elon Musk did not invent the brain-computer interface. It's been around for a surprisingly long time. The only problem is that between the year 2016 and the mid-90s, there's been virtually zero progress made at improving the methodology and implementation.
He bring the idea into another the item. He what is the right word to use? He bring it in. He actually bring it to life. The idea was always there because it with his prophecy, it prophesied in the Bible. So the idea of a chip in your head was always there for a long time, since before Elon Musk. Alright? Because the Bible, the prophecy that the Apostle John saw in Revelation 13 and 16 was some years back. It was it was about trying to remember. John was on the island of Patmos, alright, and he get that vision by the Lord show him, the Lord being Yahushua, our Messiah, show him that there will be a brain chip that the so-called white man, which is Esau Edom, would implant it to everybody, try to make everybody take it, right? So the idea was always there, alright? Elon Musk just doing the job, bringing it to life, alright?
Of BCI. So that's where Neuralink comes in. It's a modern approach to an existing technology, doing the exact same thing that Tesla did for the automotive industry. They didn't invent the electric car, but they did package that technology into a product that worked exceptionally well and solved a problem that was inherent with the previous design. The concept behind the brain-computer interface is pretty simple. Your brain is essentially just a ball of soggy electric meat, and it controls the rest of your body by generating specific electrical signals and then firing them out through your nerves and into your organs and muscles. Those electric pulses are like the programming language of the human body. Your brain is sending command prompts through your spinal cord, but sometimes that connection between the brain and body gets broken, either by a physical injury or degenerative disease. So BCI can function like a bridge for those electrical signals to bypass the broken connection. Existing BCI technology can be split into two philosophies: invasive and non-invasive. You've probably
Ain't nothing wrong with the human body. The Bible say that you're gonna get deceived by this man, and that's how we're gonna deceive you and try to tell you that the Bible is not authentic. It's not an authentic book. The ideas that is in the Bible is not authentic, right? You're gonna try to see that, all right? The body and everything that the Most High created, all right? There's a problem with it, and you're gonna try to fix it with the brain chip, all right? You're gonna try to get you to take it, all right? So that will be his game plan.
seen non-invasive BCIs. It's like a weird hat with a ton of electrode sensors all over it. This can read the electrical signals from the brain, but it doesn't do a very good job. There's an entire skull in between the sensors and the neurons, so it's no surprise that it isn't very effective. It's like trying to listen to a concert from outside the arena. You might get the thump of the bass notes, but you won't hear the vocals. So, to get a good connection to the brain, we need to go invasive with our BCI, and that's where things get gruesome. The current industry standard for invasive BCI is something called the Utah Array. It's a square computer chip with a whole ton of spikes coming out of it. I'll give you one guess where those spikes are going. Yeah, into the brain.
So what they do is cut out a chunk of your skull, spike the Utah array into the outer layer of your brain, and then attach a miniature computing device directly onto the top of your head that connects to the array on one end and has a giant wire coming out the other end. Typically, they will have to do this twice, so you'd have 2 spikes in the brain and 2 computer boxes with wires coming out the top of your head. It's brutal, but very effective. The spikes can quickly and easily read the electrical signals from the cortex region of the brain, which are then read by the computer and translated into computer code. And that process allows a person with the brain implant to control an electronic device with their brain. They can control a robotic limb like it was their own arm, or control a computer to move a mouse or type on a keyboard. The downside to this method is that it is limited to use only in medical research environments. People can't go about their lives with all of this stuff coming out of their heads. They can't even maintain this in their own homes. Also, because the Utah array is just a bunch of tiny nails in the surface of your brain, the body is going to want to reject that foreign object. It's going to get inflamed and form scar tissue around the puncture that will eventually render the device useless. So now we enter the next generation of BCI technology, currently being led by startup companies like Neuralink and Synchron. Like we said off the top, Synchron is the first to reach full human trials. They initially began testing in Australia with a group of 4 patients receiving their BCI implant. Apparently, Australia has looser regulations about what you can put into people's brains, and just last year, Synchron was given the go-ahead by the FDA to commence human testing in the United States. The first US patient just received their Stentrode implant and will be the first of 6 people involved in the $10 million study funded by the National Institutes of Health. To understand why Synchron crossed the threshold before Neuralink, we can look at the design of their implant. The Stentrode is named after a common medical device called a stent. This is just a long, thin, flexible tube that doctors can insert into a patient's blood vessel. Stents are used all the time for a number of procedures, mostly involving the heart. If you have a blocked or narrowed artery, the doctor will insert a stent tube to hold it open for you so that blood can flow and you don't have a heart attack. So, the Stentrode is actually what it sounds like, a stent combined with a cluster of electrodes. The Synchron procedure is to insert the stent with a catheter into the patient's jugular vein and run it all the way up into a blood vessel that is nestled within the motor cortex of the brain. When they pull back the catheter tube, the hollow wire mesh of the Stentrode will expand out and interface with the walls of the blood vessel, and the wire at the other end of the Stentrode is connected into a very small computer device that is implanted inside the patient's chest cavity. If this sounds at all familiar, that's just because this is virtually the exact same procedure as implanting a pacemaker. They're just running the wire into the brain instead of into the heart. The implanted computer device will then connect with the rest of the system via Bluetooth, either paired to a computer or even just a smartphone. The beauty of the Synchron procedure is that there will be nothing sticking out of the person. There will be no visible sign that they have an implant in their brain. The system can be used anywhere. The surgery can be done in any hospital setting in just a couple of hours, and most importantly, there is no need to open the person's skull or damage their brain tissue. The first patient to receive Stentrode in America is a person suffering from ALS who has no ability to move their body or even speak. Thanks to the Synchron device, this person is now able to use a computer and communicate by text just by thinking. The only downside to the Synchron is that it is only inside a blood vessel that runs through the brain. The electrode is not actually inside the cortex tissue and physically interfacing with the neurons. So the signal coming through the Stentrode is limited. It can't match the bandwidth of the Utah array. So Synchron is definitely solving many problems, but they're still not creating a whole solution. And that is where Neuralink comes in. Their Link device brings the best of both worlds from the traditional Utah array and the modern Stentrode, and they take that capability to an even higher level. So, Much like the Utah array, the Neuralink does require the removal of some skull material. You're gonna have another hole in your head, unfortunately. But then instead of just spiking a tiny bed of nails into the brain, Neuralink uses a robotic sewing machine to carefully and accurately insert incredibly fine and flexible electrode wires into the outer cortex layer. They just go in a couple of millimeters. And this way, the robot can place the electrode directly into the neuron that they want to read, going straight to the source, maximum bandwidth. And each Link device will have about 1,000 of these tiny wires. So there is an absolutely massive amount of signal coming out of the brain. And then the computer device that's attached to the electrode wires is so small that it can fit perfectly inside the new hollow void of your skull and sit flush with the bone. That way, they can just fold the skin back over and sew you up. Once the hair grows back in, there would be no visible sign that you have a computer in your skull that's hardwired into your brain. The same as the Stentrode, the Link device would pair via Bluetooth with a computer or smartphone that would read the signals created in the brain and translate them into computer commands. So, while the Stentrode uses a very familiar and well-tested medical procedure to handle the implanting of the electrodes, Neuralink is proposing an entirely unprecedented kind of robotic brain surgery. No one's ever had a robotic sewing machine stitch wires into a human brain before, and that likely means that Neuralink is going to need to present a very thorough and well-tested proposal to the FDA in order to gain their approval for human testing. We know that Neuralink are doing their current device testing in pigs and monkeys. We also know that this hasn't always ended well for the monkey. In many cases, the monkeys who were operated on were either previously deceased at the time of the operation or were so near death that they were euthanized immediately after the procedure. Those monkey deaths were planned and are a regular part of testing any medical device. In other cases, some monkeys did die because of infections or complications directly related to the Neuralink surgery. And that sucks, but that is how we learn new things about science and medicine, by first testing the idea on animals. So, I do want to say thank you to the monkeys for your sacrifice. I'm sure you would have preferred to not be killed by a brain implant experiment, but your death will not be in vain. So, as far as when Neuralink might begin their own human trials, we don't really know for sure. We know that this is something that they are actively working on with the FDA. Elon says that his company is committed to not only meeting, but far exceeding all of the safety standards involved with the trial. When asked, Elon said that he expects human Neuralink trials by the end of this year. He also said the same thing last year, but he's saying it again this year. He has to be right eventually, right? Like a broken clock kind of situation. Also, it's probably good to not be the first modern brain implant to go to human testing. There's gonna be something that can be learned from the Synchron experience that can help make Neuralink better. Again, there's more than enough room in the industry to have multiple players. It's not like Neuralink should just quit because Synchron got ahead in the testing phase. And Synchron isn't useless just because it has a lower bandwidth connection. Unfortunately, there are a lot of people in the world with varying forms of brain injury and disease, and they need all of the help they can get as soon as they can possibly get it. So, more BCI companies doing more real-world testing will always be better. Hopefully that's opened up the world of brain-computer interfaces for you just a little bit. Elon and Neuralink might be the loudest and the flashiest, and they by far get the most attention, but there is a lot of really great technology out there that is going to help a lot of people, and that's awesome. Though again, RIP to the hero monkeys.
See that? That's to deceive you. So you didn't see this microchip implant resolution AI. That's Nigeria. Our governor could use RFID microchip in millions of American inject COVID vaccine 19. This is what they was telling you when COVID was heavy.
Public health officials warn that when a coronavirus vaccine is ready, the next hurdle is how to get that vaccine out to the public quickly and in massive numbers. Joining me now is Jay Walker. He's the CEO of ApiJect, a company that entered into a $138 million deal with the Trump administration called Project Jumpstart. Welcome, Mr. Walker.
Glad to be here, Lori.
So what is Project Jumpstart?
Well, Project Jumpstart is an emergency and temporary program in the battle against COVID-19. It's a public-private partnership between my company, ApiJect Systems of America, and the Department of Health and Human Services and the Department of Defense. And its purpose is to ensure that by year end, we'll have at least 100 million doses ready to inject of a vaccine or therapeutic, assuming one is available.
And now you are going to be making these pre-filled syringes for the vaccines. What's the problem with glass vial systems of manufacturing and delivering vaccines?
Well, there's no problem with glass vials. They work wonderfully, except when you need hundreds of millions of them all at once. The supply chain for glass vials requires not only that you have all of those vials and all the materials that go with it, but it requires that you have extremely specialized filling equipment to fill all those vials. All of that equipment is currently busy. It works on cancer drugs and other life-saving drugs. There is no excess capacity to fill 100 million, 150 million or more with a new vaccine. Therefore, the U.S. government has stepped out and said, we'll need to use another way to make sure that that vaccine can be delivered to people who want it.
So how exactly does ApiJect work?
Well, if you've ever used an eyedropper where you in your eye take a little squeeze bottle, that technology is called blow, fill, seal. And that is exactly the same technology we're using. There are eyedropper facilities in the U.S., not many, but a few, that we are going to upgrade so they can handle vaccines. Then what will happen is those facilities will make the containers right here that will hold the vaccine. We will add a needle hub to them, and voila, you have a pre-filled syringe that's ready to use.
So where